The second course is the neck. Now, part 1, superficial structures of neck. The neck is divided into these three regions: anterior region, lateral region, and sternocleidomastoid region. Anterior region is divided into suprahyoid region and infrahyoid region by this hyoid bone. Suprahyoid region contains two triangles: segmental triangle, submandibular triangle. Infrahyoid region, two triangles: carotid triangle, muscular triangle. Now here, notice these three muscles: digastric, omohyoid, sternocleidomastoid, anterior belly, posterior belly, upper belly, lower belly. So lateral region continue occipital region and greater supraclavicular fossa. This is a superficial fissure in neck. After skin, we directly see this muscle, platysma. This is very thin. After this platysma, we can see this superficial vein and some cutaneous nerves. This is the nerve supply of the platysma, cervical branch from the facial nerve. Here are superficial veins of neck: anterior jugular vein, external jugular vein, and some parts communicating branch. Between them, there's a jugular arch. The nerves superficially in the superficial fissure, first is this cervical branch. Next, the superficial branches of or cutaneous branches of cervical plexus, 1, 2, 3, 4 branches. Lesser occipital nerve, greater auricular nerve, transverse cervical nerve, supraclavicular nerve. It has 3 branches. All of them come from the cervical plexus, and this point, midpoint of posterior border of sternocleidomastoid, is the anesthesia point. The superficial structures of neck. This time is to expose the superficial structures in neck. It includes the platysma, this muscle, and the external jugular vein, internal jugular vein, and the superficial cervical lymph nodes. Here, the transverse cervical nerve and other nerves, the cutaneous nerves from the cervical plexus. Here, this is the superficial layer of deep cervical fissure, just enveloping fissure or investing fissure. This one, sternocleidomastoid. First, along the median line of neck, open the skin from the mantle to the upper border of the sternum. Then do a transverse incision along the base of the mandible to the mastoid process. Upper border of the clavicle to acromion. The skin of neck is very thin and there are some transverse striae. When dissect here, the superficial must be superficial. We should protect the platysma here. Don't damage the platysma. Here, this muscle is platysma. Separate and clean the platysma. This is origin of the platysma. It originates from the pectoralis major and deltoid, the deep fissure on these two muscles. This is origination of the platysma. Then it go upward, insert to the mandible, the base of mandible, and some fibers to the angle of mouth. Now separate the platysma. It's very thin from the lower part. Put it upward. Now look at this platysma. It's very, very thin and broad. Deep to it, we can see this is the parotid gland. And this nerve is cervical branch from facial nerve. Maybe one branch, maybe two branches, and supply or control the platysma. After it, look at this white layer. They are superficial fissure, contains some fat tissues. Here, separate some superficial cervical lymph nodes. And separate a external jugular vein. Okay, this is one lymph node. This is a jugular vein. Here, superficial cervical lymph node, external jugular vein, lymph node. Notice these superficial cervical lymph nodes arranged along this external jugular vein. Another vein is here. It's along the anterior border of the sternocleidomastoid. This is the anterior jugular vein. Anterior jugular vein. From this point is where the midpoint of posterior border of sternocleidomastoid. Look for the cutaneous nerves of cervical plexus. Okay, this one is the great auricular nerve. Skin of the auricle. Lesser occipital nerve, skin of occipital region. Transverse cervical nerve, skin of anterior cervical region. Supraclavicular nerve, skin of the root of neck. and the upper part of thorax. There are 4 branches from the cervical plexus, cutaneous nerves. Now, look at remove the superficial fissure. You can see this white color membrane. This is a deep fissure. Cervical deep fissure. Cervical fissure, it includes 3 layers: superficial layer, middle layer, and the deep layer. Here, this layer is the superficial layer, enveloping fissure or investing fissure. It covers the sternocleidomastoid and to upward enclose the submandibular gland, enclose the sternocleidomastoid, and go upward enclose the carotid gland. It forms some sheath. It continues medially. Bilateral sides, 2 enveloping fissure fuse together here. Fuse together. This is a white line of neck. So this line is formed by 2 enveloping fissure. From the upper border of sternum, this enveloping fissure is divided into 2 layers. Now here open the anterior layer. Separate the anterior layer here, enveloping fissure. Deep to anterior layer. You can see here anterior layer. Then here is the posterior layer. Both are enveloping fissure. Between them, this is a space. The space name is suprasternal space. Inside the space, some fat tissues here, and this arch, jugular arch. This is between 2 anterior jugular veins. Jugular arch. This is the contents of suprasternal space. Now, here, this is the mandibular of sternum, or upper border of sternum. Here, this is the laryngeal protuberance, the structure of the thyroid cartilage. Between them, the midpoint. This is midpoint. This midpoint, just the upper border of this suprasternal space. Continue to dissect the enveloping fissure on the surface of the sternocleidomastoid. Separate it. So expose the muscle fibers of sternocleidomastoid. You can see this enveloping fissure here is also 2 layers. Anterior layer is here, posterior layer is deep to this muscle. So it forms a sheath of sternocleidomastoid. Sternocleidomastoid, it has 2 heads, 1 and 2. This head is sternal head. Another head is the clavicle head. Sternal head originates from sternum. This one originates from the medial part of clavicle. Then 2 heads fuse together. One muscle go upward, insert to the mastoid process and the superior nuchal line. Here, open the enveloping fissure continue, expose the infrahyoid muscles and suprahyoid muscles. This one is a hyoid bone. This one is thyroid cartilage. So they are infrahyoid muscles. There are two groups. This muscle is from sternum to the hyoid bone. This muscle is from the scapula to the hyoid bone, myohyoid. From the anterior border of sternocleidomastoid, anterior median line, and inferior border of mandible. Okay, this triangle is anterior region of neck. This part is the sternocleidomastoid region. Posterior border of sternocleidomastoid, anterior border of trapezius, and the clavicle. Okay, this region is lateral region of neck. This is the three regions of neck. Okay, summary. The first layer is the skin. Here is meant to summarize the superficial layer, superficial structures of neck. Then the second layer is superficial fissure. Inside this superficial fissure, it contains this muscle, platysma. And this anterior jugular vein, external jugular vein, and the superficial cervical lymph nodes, and some cutaneous nerves of cervical plexus, for example, transverse cervical nerve, great auricular nerve, lesser occipital nerve, and supraclavicular nerve. Then this one is the enveloping fissure, the third layer. It covers, this is the sternocleidomastoid. They are supra and infrahyoid muscles. This is fourth layer muscle.